I'm Carol Otto, and I'm the administrative assistant in the nursing program. And some of my duties are to advise students. I'm also the first point of contact when people either call or come in. And so I have a lot of contact with everybody around in the department. Outside of the office, I adopt and rescue greyhounds.
Hi, my name is Dr. Amanda Jajola, and I am the director of the nursing program at Adams State University. I have been here now for about 3 years as the director, and I've been with the college now since 2005. I also teach, and I teach the health assessment course, both online and face-to-face, for both RN to BSN program and the traditional 4-year program. I am a family nurse practitioner. I received my family nurse practitioner in 1999. I've been a nurse now since 1989. I have worked in medical surgical nursing, neurosurgery, internal medicine, ENT, ears, eyes, nose, and throat, family practice, and I think I said internal medicine. An interesting fact about myself: on my spare time, when I have time, I like to do Zumba, and I actually like to exercise. So I like to practice what I preach.
Hello, my name is Dr. Elliott, and I am here at Adams State University in the nursing program. And I teach in both tracks that are available. On the traditional side, I mainly teach pediatrics and pharmacology. I also teach service learning. And on the RN to BSN side, I teach professional practice, service learning, and I've also have taught research in the past. I have been at Adams State now for 6 years, starting off in the RN to BSN program, and then took a leave of absence to further my own education, and then came back for this year full-time in the traditional program. So I've been a nurse for almost 24 years this May, and 23 of those years have been in pediatrics in one form or another. I started my career off at Children's Mercy Hospital as a bedside nurse in hematology oncology, and I went back to school after a year to get my pediatric CNS. And then after that, I've had multiple positions as a CNS or as a manager or in IT, but all connected to pediatrics in one way or another, until I came to Adams State, and so decided to give teaching a chance, and I love it. And just recently started working at the pediatric clinic over at the San Luis Valley Regional Medical Center in the pediatrics clinic as a pediatric nurse practitioner. One fun, interesting thing about me is I like to do paper crafting. So I scrapbook, I make cards, and just try to be creative in one way or another involving paper.
I'm Allison Bennett. I'm the Nursing Simulation Laboratory Coordinator for the nursing program here at Adams State. I basically work with all the different classes and work with curriculum as far as simulation and help to improve the active learning strategies here at Adams State. I've been a nurse for about 11 years, and my last practicing position was as a hospice nurse. I've worked in acute medical care, I've worked in oncology, I was an infectious disease specialist, I was an IV infusion nurse, so I have a lot of different background. My husband and I, we are currently building a sustainable home called an Earthship in the Sangre de Crystal Mountains.
What is an Earthship?
Basically, it's a house made out of tires and glass bottles and cans, and it's using renewable resources, and we're kind of trying to be green.
Hi, my name is Ricky Leva, and I'm a senior nursing student at Adams State University. In part 1 of this film, the topic, What to Expect in the Nursing Program, will be further discussed for future nursing students to understand the requirements and the many demands as well.
Hi, I am Jackie Byers. I am also a senior nursing student at Adams State. Later in this film, we'll be talking about 10 tips on how to be a successful student nurse. This will help you succeed through the program and the national examination after graduation.
We have also included an introduction of the staff of the nursing program as well. There are 2 nursing program tracks, one the traditional BSN program and 2 the RN to BSN completion program.
To apply to this program, you need to have 74 credit hours. After acceptance, the program takes 2.5 years to complete. Every spring semester, the program accepts 30 students.
In order to get accepted into the Adams State Nursing Program, there's a list of things to get done, such as meet with a nursing advisor, find out the necessary prerequisites, take the technology proficiency test or the class, become CNA certified, minimum GPA of 3.0, and apply to the program, be CPR and CNA certified, update immunization record, clean background check, community service, 2 letters of recommendation, and a resume. Applications are due August 1st and notification of admission on November 1st. The prerequisites necessary for entrance into the nursing program include English 101, English 102, Psych 101, Psych 233, Sociology 201, Psych 211, Math 106, Math 111, Biology 125, Biology 205, Biology 206, Biology 215, Chemistry 105 with the lab, 1 history class, and 2 arts and humanities courses, such as music and theater. A grade of C or better is required in all biology, chemistry, psychology 211, and math 111 courses. The application process includes proof of certified nursing aid, drug screening, background check, and an essay question. You could also join the Adams State Student Nursing Association to meet other fellow student nurses and to also keep updated on anything new in the program. Some things to expect in the program are proficiency in writing in APA format, learn to critically think, do not just memorize for exams, you need a flexible schedule for class, study time, and clinicals, medication calculation exams, and 75% minimum to pass courses and maintain a 2.5 cumulative GPA.
You also need some extra money for scrubs, stethoscopes, and blood pressure cuffs. Find different learning methods, such as groups, individual learning, or even working with a tutor. If you are an athlete or work another job, it is key to find a balance. Work with the nursing program and your coach or your boss.
Nursing school can easily become overwhelming at times. Here are 10 tips that will help create an efficient and successful student nurse.
Let us start with tip number 10, which is strive to do your best.
Nursing school is not a place where A's are common, but if you put 100% of effort in the program, you will succeed.
Don't beat yourself up if you don't get all A's. It's good to know that even registered nurses need to look things up from time to time.
Tip 9 is to get involved with Adams State Student Nursing Association, otherwise known as ASSNA. ASSNA is a student nursing organization where all levels of students obtaining a nursing degree from ASU come together and help the local community.
Here you can get to know other students are ahead of you in the program and talk to them about their experiences and what they have learned. Then you can apply these newly learned strategies to better yourself as a student. It is important to know that ASSNA looks great on a resume. Tip 8. We do not recommend having a job while in the program.
Dedication in nursing school is vital for success in the program. A sufficient amount of time needs to be committed to schoolwork in order to obtain optimal level of knowledge. Having a job only creates more stress and less time for the schoolwork.
For some students, there's no way around having a need for a job. Our tip for you all is cut down on hours. The more time you can spend on school, the better. Tip number 7 is to start practicing NCLEX questions now.
The NCLEX is a certification exam that a newly graduated student nurse will take to receive their RN status.
Starting to study NCLEX questions now will not only help you with the NCLEX, it will also help you with HESI questions in class.
HESI is a test formulated to reflect the NCLEX. You will take these tests and see where you would stand compared to the NCLEX standards.
There are many avenues that you can take to study the NCLEX questions. Textbooks, like this,
free app downloads to your smartphones,
and even the internet has free websites where you can study, such as Kaplan, NCLEX Masters, and NCLEX Reviewers.
It is never too early to practice. The NCLEX is not easy, so study, study, study.
Tip number 6 is to use the nursing school amenities to your advantage.
Use a sim lab on open sim lab days. More practice helps create a more efficient student nurse.
The more you practice a task, the more comfortable you will feel performing it in clinical.
And also, don't forget about the library. The library offers a great place to gather information for papers.
The library also offers a quiet environment to study.
We are at tip number 5. Faculty members at Adams State University Nursing Program are here to help.
Every teacher in the nursing program has office hours. These hours are meant to help students. You should use those hours to ask questions or go over information you didn't understand in class.
You can go into these office hours to go over a paper that is due next week.
And review answers you got wrong on a test. Take advantage of these hours to better yourself as a student nurse. Tip 4 is to learn APA format early on.
APA format is crucial to learn in the nursing program. You will use it in every class, so it is important to learn it correctly.
If you are thinking you want to further your education and obtain a master's degree, each and every paper you will read and write will be in APA format.
If you remain an RN, you still need to keep up on current articles, which are also written in APA format.
I can't stress this enough. APA format is a vital necessity in nursing school.
Being professional in school enhances learning and is also our tip number 3.
Coming to class and looking the part as a put-together student nurse tells a teacher class is important to you.
Coming to class every day on time is also key. The more you miss, the less you learn.
Finally, in being a professional, if you have a question, ask. Even though no one else is asking, I bet other people are thinking it. So ask the question to the teacher rather than your neighbor. Taking care of yourself is our tip number 2. This tip is vital, not only for school, but for your sanity.
Find things that are not school related that you enjoy. This will get your mind off school once in a while.
Focusing on school 24/7 is not healthy. You will burn out eventually. Taking necessary breaks from school to relax is imperative for a healthy, successful student nurse.
Tip number 1 is all about time management.
It is important not to be a procrastinator in this program. Procrastination brings nothing but unneeded stress. Having a calendar or a schedule can help a student nurse manage their time proficiently.
Study effectively and efficiently while using the books that are listed on the required readings. Also, don't cut corners. You're not making your homework easier, you're just limiting your learning. And lastly, take your time. Nothing done fast is 100% correct.
As student nurses ourselves, Ricky and I, as well as the Adams State University Nursing Program, do believe that if you follow these 10 tips on being a successful student nurse, you will graduate from this program and become a great registered nurse.